Let's now put the focus on India. The country is all set to launch a massive exercise from the 7th of May to repatriate the Indians who are stranded abroad because of travel restrictions. The massive exercise would involve Navy ships and a public carrier. In the first 14 days, the government intends to bring back 14,000 people who have been stranded across the globe because of the coronavirus. The massive exercise will start on the 7th of May. India intends to bring back 4,350 people from the Gulf countries in the first week of the evacuation. 2,100 Indians from the United States, 1,750 people from the United Kingdom and Malaysia, and 1,400 Indians from Bangladesh. 1,250 from Singapore and the Philippines would be evacuated. And India will operate 64 flights and globally evacuate 14,000 Indians. Maximum flights will be from Kerala, which stands at 15, followed by the state of Tamil Nadu and NCR, which stands at 11. On the other hand, the Navy will be deciding whether to deploy 3 ships, and the INS Jalashwa, INS Magar and INS Shardul are among them. These will be deployed for these operations. The INS Jalashwa is Indian Navy's largest amphibious platform, which can carry 1,000 troops, and with the current social distancing guidelines in place, it would be able to carry only 700 people. This is going to be the largest repatriation mission of the Indian government. India will be bringing back 192,000 people in the first phase of this mammoth exercise. Sources told Wion that data collection is ongoing in most missions, with which we are looking at dates for evacuation and making all necessary arrangements accordingly. The facilitation will only be on compelling grounds and will be done through planes and naval ships. This will take place on a payment basis, and non-scheduled commercial flights would be arranged for air travel. During the process of getting these Indians back, all health protocols like social distancing norms will need to be followed. The evacuees, after reaching the destinations, would have to register on the Indian government's Arogya Setu app, which has been developed to alert people about the COVID-19 crisis. After being medically screened, these evacuees will then be quarantined for a period of 14 days in a hospital or an institutional quarantine facility on payment basis by the state governments, which will be followed by a COVID-19 test at the end of this given period.